Hi, my name is Erika Saucedo. I'm a board certified ophthalmologist, and I wanted to show you how I recommend putting in eye drops. So I have patients that are on multiple eye drops, and some of them are even multiple times a day, especially our glaucoma patients. And so you can imagine they're putting in drops all different times throughout a day. And the way that we were originally taught to teach our patients and to put in an eye drop is to pull the lid down, look up, and then put the drop in. And while that's effective and you can get the drop in that way, I do not recommend that, because you can imagine if you're doing that multiple times a day, or even just a few, even once a day, that's gonna pull on the thinnest skin of our body multiple times, and it's gonna cause a laxity, or the skin is gonna become less elastic, which happens anyway as we age, right? And so some of my patients who have glaucoma have been on multiple drops for many years. Unfortunately, a lot of these patients get what's called an ectropion, where the lid no longer is taut or tight up against the eyeball like it should be, and then it kind of falls out, and that's what an ectropion is. And then you need surgical repair for that. So instead of doing the pull down, look up, and put the drop in, what I recommend is, just to show you too, there's different kinds of drops. So you have drops that are in a bottle, or drops that are in preservative-free form, and I'll show you both. So in the bottle, how I recommend doing it, first thing is stabilizing the hand, right? So you can stabilize your hand on your cheek, or you can stabilize it on your nose. And this is actually a surgeon trick. I mean, I was taught this as a resident. Don't operate like hanging out in the air, right? Because you have no control. This way, at least you have some stability and control. And then what I ask my patients to do is, get up to the mirror, look up at the mirror, which I can't do with this right now, so I'm doing this without. And then just basically dropping it into the eye. So you'll be able to see that in the mirror. You can do it nasally too, and again, I'm doing it without seeing. So I had to kind of tuck that one in because it was about to roll down. But that's another technique. If you drop it here and kind of roll it in, that is safe to do. And that way you're not pulling on the skin. So that's with the bottle. That's how I would recommend it. If you have the preservative-free, it's going to be the same idea. So, these are the preservative-free ones. So I'm going to show you on the other eye because this eye is starting to get wet. But so stabilize the hand, look up into the mirror. I'm going to tilt it so it's coming down. And then put the drop in the eye. And again, you can do it laterally, or you can do it nasally, whatever's comfortable for you as far as seeing in the mirror. I find that laterally I can see better, right, because I can tilt my head towards that mirror. The other thing, since we're here, that I wanted to mention is these preservative-free vials. I personally like preservative-free. So for example, if you're using an artificial tear and you're not sure which one to get, if you go down the artificial tear aisle in Walgreens or Walmart or CVS, there's so many to choose from. Safest bet is a preservative-free, because that's gonna be the most gentle, and obviously it doesn't have any preservatives. Typically the preservative-free comes in vials like this. And so when you read the instructions, it's gonna say crack open the top, and then use it once, and then throw this away. I let my patients know that I believe that it is okay to reuse them as long as you're not, getting this tip dirty. And the way you can do that, most of them you can actually recap it. So you just push that cap back on, and then see all those drops right there. You can reuse those. And I ask my patients, after 24 hours, probably a good idea to throw it away, because there are no preservatives. Remember, preservatives help prevent any kind of bacterial growth in these drops. So, 24 hours, probably a good time to open up a new one. Some of my patients, because it's pretty warm here, will put them in the refrigerator. I think that's a great idea too. Also, it can feel cooling when you use it. But essentially, you can reuse these because they are more pricey, and then this way you're getting a little bit more bang for your buck with reusing it. All right, that was pretty much it. Thank you so much for watching, and I hope you're having a great day. Okay, bye.